An opioid overdose is always an emergency. Call 911 right away if you think someone is having an overdose.
If you suspect an opiate overdose, check to see if the person is responsive. If the person is not awake or not responsive, start rescue breathing while getting naloxone ready.
To administer naloxone, follow the instructions included in the naloxone kit and from the 911 operator.
It's safe to inject naloxone even if someone is not having an opiate overdose. When in doubt, administer naloxone.
Naloxone kits are free, and you can find your nearest one by calling 811. This video focuses on how to administer naloxone from the Take-Home Naloxone Kit program in Newfoundland and Labrador. Naloxone kits are free and confidential, and you can find your nearest kit by calling 811.
We will also learn about who is at risk of an opioid overdose, as well as the signs and how to respond.
Before we get started, we'd like to highlight that an opioid overdose is always an emergency. Always call 911 if you think that someone is having an overdose. Who is at risk for an opioid overdose? Individuals who are taking prescription opioids more often or at higher doses than recommended, taking opioids with alcohol or sedatives such as sleeping pills, muscle relaxants, benzodiazepines, which typically are substances that are taken for sleep disorders and seizures and anxiety, people who are injecting drugs, people who are taking opioids that their body isn't used to or switching to a stronger drug, taking higher doses than what someone may be used to, using drugs of unknown purity or strength, or individuals with other health conditions like liver or kidney disease or breathing problems.
Overdose risks can also increase after involuntary or voluntary abstinence. Because a person's tolerance to a drug decreases quickly, they may not be able to take the same amount of a drug as before if they haven't used even for a short period of time. The strength and type of opioids available on the street are unknown and can vary. This can increase the risk of overdose and death. Some opioids called fentanyl and carfentanil can be particularly dangerous because they can be fatal even in very small amounts, are being mixed with or disguised and sold as street drugs such as heroin, cocaine, counterfeit prescription drugs such as oxycodone. Remember, opioids may be present in substances that are sold as something else. When in doubt, give naloxone. It's safe to inject naloxone even if someone is not having an opioid overdose. Signs of an overdose. Recognize the signs and symptoms of an overdose, including difficulty walking, talking, staying awake, blue or gray lips or nails, very small pupils, cold and clammy skin, dizziness and confusion, extreme drowsiness, choking, gurgling, or snoring sounds, slow, weak, or no breathing, inability to wake up even when shaken or shouted at.
Response to opioid overdose. Call 911. An overdose is always an emergency. Even if someone has taken naloxone, it can wear off before the person has completely recovered from their overdose. They may need more than one dose. Always call 911 for help. Follow the directions in your naloxone kit and from the 911 operator.
Rescue breathing.
If the person is not breathing, you need to begin rescue breathing while you are getting naloxone ready. Because an opioid depresses breathing, it is important to keep oxygen flowing to the brain.
Tilt the chin up to open the throat and the airway. Clear away anything in their mouth that is blocking the throat or their airway. Use the face shield mask from the kit to cover the mouth. Pinch, plug the nose with one hand and give 2 even breaths. This should make their chest rise. If the person doesn't wake up, inject the naloxone in the top of their arm or their thigh or upper leg muscle. Continue rescue breathing, giving 1 breath every 5 seconds for 2 minutes. How to administer naloxone.
So you want to take your vial of naloxone. Sometimes a little naloxone gets stuck in the top, so you just want to swirl it around to ensure all the naloxone is in the bottom of the ampule, and it is. Okay, so then you want to put your snapper on. You want to put the star side on the bottom. Sometimes these already come on the ampules, but if they don't, they'll be in the kit. So you want to just lay that over the top, and then you want to break away from yourself. Then you want to open your syringe. So we say it's like a cheese string. Open it like this. Take out your needle, remove the top. Hold your naloxone. I hold mine at an angle. You just put this to the bottom. Don't put too much pressure on. You just want enough to touch the bottom. And you haul up the naloxone. Okay, so I have all the naloxone now in the syringe. I'm just going to expel some of that air. Like that. So then you want to actually inject someone. So once the liquid is in the syringe, you want to inject the person in the upper arm or the thigh area. And you should be doing this at what you can at like a 90-degree angle. So it's almost like a dart. So you want to go straight down, and then you want to expel the naloxone until you hear 2 clicks. And that needle should auto-retract, and you've just given your first dose of naloxone. Naloxone should begin working in 2 to 3 minutes. Is naloxone working? If the person is breathing or wakes up within 2 to 3 minutes after the first injection, the naloxone has worked. Make sure that you have called 911 and that someone is looking out for the patient. If the person is not breathing or awake, inject the second dose from the other ampule 2 to 3 minutes after the first dose. If after the second dose they have not revived, administer the third dose 2 to 3 minutes after the second dose. If the person is not breathing or awake, continue rescue breathing until emergency help arrives.
Recovery position. If you ever have to leave someone alone, put them in the recovery position. Roll the person on their side. The head should be tilted back a little. Put the person's hand under their head. Bend their knee forward to stop them from rolling onto their stomach. This is very important so the person doesn't choke.
When naloxone starts working. When the naloxone starts working, the person may wake up suddenly or slowly, or may be disoriented. Also, naloxone may cause mild to severe withdrawal symptoms for someone who's dependent on opioids. Withdrawal symptoms may include agitation, anxiety, muscle aches, sweating, nausea, and vomiting. Explain to the person that you have given them naloxone to save them. Provide reassurance and tell the person to not use drugs for at least 2 hours. Stay with the person until emergency responders arrive. An opioid overdose is always an emergency. Call 911 right away if you think someone is having an overdose. Naloxone kits are free, and you can find your nearest one by calling 811.